In this topic, we will explore the principles of oxygen therapy, including its purpose, benefits, and key considerations in EMS. By the end, you will have a better understanding of oxygen tanks, various oxygen delivery systems such as nasal cannulas, and how to measure oxygen concentration using a pulse oximeter. Ambient air contains approximately 21% oxygen, which is typically sufficient for the human body to sustain normal function. The respiratory system efficiently extracts oxygen from the air and delivers it to the bloodstream, where it is transported to tissues and organs. Under normal conditions, a healthy individual can maintain adequate oxygenation without supplemental oxygen, as the body is adapted to using this concentration effectively. The remaining 78% nitrogen and trace gases in the air do not contribute to oxygenation, but help maintain lung function and pressure balance. However, in cases of respiratory distress, injury, or certain medical conditions, supplemental oxygen may be required to ensure adequate oxygen delivery to tissues. Low oxygen levels, or hypoxia, can lead to serious and life-threatening complications in EMS patients. Without sufficient oxygen, cells and organs begin to fail, causing confusion, cyanosis, tachycardia, and, in severe cases, respiratory or cardiac arrest. Hypoxia can result from conditions like airway obstruction, respiratory failure, trauma, or shock. EMS providers must quickly recognize signs of hypoxia using assessment tools like pulse oximetry and administer supplemental oxygen or advanced airway interventions as needed. Prompt oxygenation and ventilation are critical to preventing irreversible brain damage and organ failure. Pulse oximeters are an essential tool in EMS, providing real-time monitoring of a patient's oxygen saturation, SpO2, and pulse rate. These small, non-invasive devices clip onto a patient's finger, toe, or earlobe and use light absorption to measure the percentage of hemoglobin carrying oxygen in the blood. For EMTs and paramedics, pulse oximetry is a critical assessment tool for identifying hypoxia, monitoring respiratory conditions, and guiding oxygen therapy. In cases of respiratory distress, trauma, or cardiac arrest, a pulse oximeter helps determine the effectiveness of ventilation and circulation. However, while pulse oximeters are valuable, EMS providers must understand their limitations. Readings can be affected by poor perfusion, nail polish, ambient light, and conditions such as carbon monoxide poisoning, where carboxyhemoglobin can falsely elevate SpO2 levels. Therefore, pulse oximetry should always be used alongside clinical assessment and other monitoring tools like capnography. Despite these limitations, pulse oximeters remain a fast, reliable, and indispensable device in pre-hospital care, allowing EMS professionals to make timely, informed decisions in critical situations. Oxygen cylinders are a crucial component of EMS, providing life-saving oxygen therapy for patients experiencing respiratory distress, trauma, or cardiac events. In the U.S., medical oxygen tanks are universally color-coded green for easy identification. The most commonly used size in EMS is the D cylinder, which is compact and portable, making it ideal for use in ambulances and during patient transport. These tanks typically hold around 425 liters of oxygen at 2,000 psi and are equipped with a regulator and flow meter to control oxygen delivery. EMS providers must ensure cylinders are properly secured, checked for adequate supply, and replaced when pressure drops below safe levels. Despite their small size, D cylinders play a vital role in pre-hospital care, ensuring patients receive essential oxygen when they need it most. Connecting a regulator to an oxygen tank is a fundamental EMS skill that ensures a controlled and safe oxygen supply. First, confirm that the tank is green and properly labeled for medical oxygen. Before attaching the regulator, quickly crack the tank open by turning the valve slightly and then closing it. This clears any dust or debris. Next, align the regulator's pin system with the corresponding holes on the tank's valve stem, ensuring a proper fit. Secure the regulator by tightening the T-handle or screw until it is firmly attached. Once in place, slowly open the tank valve while watching the pressure gauge, which should read around 2,000 psi if full. Adjust the flow meter to the desired liters per minute, LPM, based on the patient's needs, then attach the oxygen tubing. Always check for leaks and ensure the system is functioning properly before administering oxygen. Nasal cannulas are one of the most commonly used oxygen delivery devices in EMS, providing a simple and effective way to administer supplemental oxygen to patients in respiratory distress. This lightweight, non-invasive device consists of soft prongs that rest in the patient's nostrils and is connected to an oxygen source via flexible tubing. EMS providers typically use nasal cannulas for patients who require low-flow oxygen, such as those with chronic obstructive pulmonary disease, COPD, mild hypoxia, or post-cardiac arrest care when high-flow oxygen is not necessary. The standard flow rate ranges from 1 to 6 liters per minute, LPM, delivering approximately 24% to 44% oxygen concentration depending on the patient's tidal volume and respiratory effort. Because nasal cannulas allow patients to talk and eat while receiving oxygen, they are often a preferred option in non-critical cases or when patient comfort is a priority. In the pre-hospital setting, nasal cannulas are particularly useful for maintaining oxygenation in stable patients while avoiding the risks associated with excessive oxygen administration. For COPD patients, excessive oxygen can suppress their hypoxic drive, leading to respiratory depression, so titrating oxygen to maintain SpO2 levels between 88 to 92% is essential. EMS providers should always monitor pulse oximetry to guide oxygen therapy and adjust flow rates as needed. Additionally, nasal cannulas can be used in conjunction with other oxygen delivery methods, such as non-rebreather masks or CPAP devices, when higher oxygen concentrations are required. They are also valuable for patients who cannot tolerate a mask due to anxiety, facial trauma, or claustrophobia, making them a versatile tool in the EMS oxygen therapy arsenal. Despite their benefits, nasal cannulas have limitations that EMS personnel must consider. They are ineffective for patients in severe respiratory distress or those requiring high-flow oxygen, such as in cases of major trauma, shock, or respiratory failure. Furthermore, dry oxygen flow can cause nasal irritation over time, which is why humidified oxygen is preferred for prolonged use, though this is not always available in the pre-hospital setting. Proper placement is also crucial. Prongs should face downward into the nostrils to ensure efficient oxygen delivery. While nasal cannulas are a simple device, their correct application and monitoring are vital in ensuring patients receive adequate oxygenation while avoiding potential complications in the field. Non-rebreather masks, NRBs, are a vital oxygen delivery device in EMS, used for patients experiencing severe respiratory distress, hypoxia, or trauma. These masks provide high-flow oxygen, typically between 10 to 15 liters per minute, LPM, delivering nearly 90 to 100% oxygen concentration. The mask features a reservoir bag that fills with oxygen and one-way valves that prevent the patient from inhaling exhaled air, ensuring they receive the highest possible oxygen concentration. NRBs are commonly used for conditions such as acute respiratory failure, carbon monoxide poisoning, or shock, where maximizing oxygenation is critical. EMS providers must ensure the reservoir bag is fully inflated before placing the mask on the patient to prevent rebreathing of carbon dioxide and maintain optimal oxygen delivery. In the pre-hospital setting, non-rebreathers are often the go-to device for patients who require aggressive oxygen therapy but can still breathe adequately on their own. However, they are not suitable for apneic or severely hypoventilating patients, as NRBs do not provide ventilatory support. In such cases, EMS providers must transition to bag valve mask, BVM, ventilation or advanced airway management. Additionally, NRBs require careful monitoring, as prolonged high-flow oxygen use may lead to complications such as oxygen toxicity in certain patients, particularly those with chronic obstructive pulmonary disease, COPD. While the risk is generally lower in acute pre-hospital care, EMS providers should always reassess the patient's condition and adjust oxygen therapy accordingly. Proper application of an NRB involves securing the mask snugly over the patient's nose and mouth, ensuring an effective seal without causing discomfort. EMS personnel should continuously monitor for signs of respiratory improvement, such as increased oxygen saturation levels and decreased work of breathing. If a patient remains hypoxic despite NRB use, providers must consider alternative interventions, such as continuous positive airway pressure, CPAP, or assisted ventilation. While simple in design, non-rebreather masks play a crucial role in pre-hospital care, offering a rapid and effective means of delivering high-concentration oxygen to critically ill or injured patients. Bag valve masks, BVMs, are essential tools in EMS and pre-hospital care, used for ventilating patients who are not breathing adequately or at all. A BVM consists of a self-expanding bag, a one-way valve, and a face mask that creates a seal over the patient's nose and mouth. These devices deliver positive pressure ventilation, PPV, when squeezed, helping to maintain oxygenation and prevent hypoxia in critical patients. BVMs are most commonly used in cases of respiratory failure, cardiac arrest, and trauma where a patient is unable to maintain their own airway. When connected to an oxygen source, they can deliver nearly 100% oxygen, making them highly effective in resuscitation efforts. Proper use requires skill and practice, as an improper seal or excessive ventilation can lead to complications such as gastric inflation or decreased cardiac output. Effective BVM ventilation requires a good mask seal and proper airway management. The most common technique for a single rescuer is the CE clamp method, where one hand forms a tight seal around the mask using a C shape with the thumb and index finger while the other fingers lift the jaw. However, in an ideal setting, 2 rescuers should be used, one to hold a mask and maintain an open airway while the other squeezes the bag. Additionally, inserting an oropharyngeal, OPA, or nasopharyngeal airway, NPA, can help keep the airway open, especially in unconscious patients. Rescuers must be cautious of overventilation, as providing too many breaths or squeezing the bag too forcefully can cause increased intrathoracic pressure, reducing blood return to the heart and worsening patient outcomes. BVMs are crucial in both basic and advanced life support, but their effectiveness depends on proper technique. EMS providers should always assess chest rise to ensure adequate ventilation and consider adjuncts like capnography to monitor CO2 levels. In some cases, when manual ventilation is difficult or prolonged ventilation is needed, advanced airways like endotracheal tubes or supraglottic airways may be used in conjunction with the BVM. Regular training and hands-on practice are vital for EMS providers to master BVM use, ensuring effective ventilation in high-stress, life-threatening situations. Oxygen therapy is a critical component of EMS, ensuring adequate oxygenation for patients in respiratory distress, trauma, or cardiac emergencies. Ambient air contains 21% oxygen, which is usually sufficient for healthy individuals, but hypoxia can lead to severe complications requiring immediate intervention. EMS providers use various oxygen delivery methods, including nasal cannulas for low-flow oxygen, non-rebreather masks for high-concentration oxygen, and bag valve masks, BVMs, for assisted ventilation. Oxygen cylinders, commonly the green D-size tanks, supply medical oxygen, with regulators controlling flow rates. Pulse oximeters help monitor oxygen saturation, though they have limitations, such as inaccurate readings in carbon monoxide poisoning or poor perfusion. Proper equipment use, including securing oxygen tanks, ensuring tight mask seals, and avoiding overventilation with BVMs, is crucial for effective patient care. EMS professionals must continuously assess oxygenation and adapt interventions based on patient needs to prevent complications and improve outcomes. Thank you for completing this lesson. We hope you found the course informative and valuable. Please proceed to the post-test to assess your understanding of this topic. And thank you for visiting EasyEMSCEU.com.